We begin with news from our state capital. Governor Gavin Newsom is facing heat from some in his own party over health care cuts impacting undocumented Californians. Several Democratic lawmakers are calling him out, demanding he end the freeze on new Medi-Cal enrollment for undocumented adults. 17's Capitol correspondent Eitan Wallace has their message and the Newsom administration's response.
Governor, reverse these cuts.
Los Angeles Democratic State Senator Maria Elena Durazo and other Democrats with that message for Governor Gavin Newsom, urging him to reverse a freeze on new Medi-Cal enrollment for low-income undocumented adults.
They are not a burden on California. They are contributors. They are taxpayers.
The public debate on this matter was in the spotlight last year when the Newsom administration announced the state had to take out more than $6 billion in loans to ensure it had enough money to keep funding Medi-Cal, the publicly funded program providing health care for more than 14 million low-income Californians, including undocumented residents. The Newsom administration blamed Medi-Cal's financial strain on a number of issues, including higher health care costs, an increasing number of seniors, and the state's decision to expand Medi-Cal benefits to undocumented Californians.
There are investments that we are making that we simply cannot continue to make.
To help balance the budget, Newsom agreed to freeze new Medi-Cal enrollment starting January 1st of this year. Any undocumented adults who had enrolled by 2026 will have to pay $30 monthly premiums beginning next summer.
This is not a budget solution.
Durazo's new bill, SB 1422, would reverse Newsom's enrollment freeze. She's also calling on the governor to reverse a decision that would see Medi-Cal stop covering non-emergency dental services for undocumented adults and some green card holders starting this July. She and others here also want the governor to throw out a proposal that could see refugees and asylees lose Medi-Cal coverage as well. Durazo believes in the long run the cuts will ultimately cost taxpayers more as they fund an increasing number of emergency room visits.
When people cannot see a primary care doctor, they do not stop getting sick. They wait. And then, when they can wait no longer, they show up in the emergency room at 10 times the cost of a routine visit.
Newsom's office says it does not comment on pending legislation, but the governor puts part of the blame on President Donald Trump for his H.R. 1 law the Newsom administration says will lead to at least $16 billion in federal health care cuts for California. Newsom has long maintained he will do what he can to promote health care for all, something he expressed during this Capitol interview last year.
I believe in universal health care, and it's just a core principle.
But Republicans say it's unaffordable.
The reality is our fiscal house is on the brink of collapse.
And negotiations over the governor's spending proposals are ongoing. He's expected to present his updated budget in May. At the state capitol, Eitan Wallace, 17 News.